Hello, my name is Dr. Dewan S. Raja. Today I will discuss about surface anatomy of external carotid artery. The external carotid artery is a branch of the common carotid artery. It is not a content of the carotid sheath. The external carotid artery has 8 branches in the neck, and it has also some muscular branches. We'll go through the named branches of the external carotid artery and we'll outline the surface anatomy of the external carotid artery. The external carotid artery can be outlined by joining the following point, a point on the anterior border of the sternocleidomastoid muscle. This is the sternocleido from sternum clavicle to the mastoid process. This is the muscle. If you tell a person to move the neck, the muscle will be prominent. So a point on the anterior border of the sternocleidomastoid muscle at the level of the superior border of the thyroid cartilage. If we follow the laryngeal prominence, the thyroid cartilage at the superior border level on the anterior border of the sternocleidomastoid muscle, we'll have the first point here at the level of the upper border of the thyroid cartilage. Okay, then we'll get the second spot where from that is just above the midpoint of a line joining the angle of the mandible. This is the angle of the mandible and the tip of the mastoid process. This is just above the midpoint of the line joining the angle of the mandible and the tip of the mastoid process. Okay, so you can also say it is at the neck of the mandible. Okay, if you tell the patient to move, then you can get the neck of the mandible. So the lower part of the neck of the mandible, we may have the second point, or a point between the angle of the mandible and the tip of the mastoid process midpoint above it. Okay, so these 2 points are connected by double lines slightly convex forward in the lower half, convex forward in the upper half. Actually, it may vary, but idea is that the external carotid artery may not be straight. It may be curved, little bit curved. It may be convex. Okay, it may be partly concave on the other side. This is due to the branching of the external carotid artery and the level of atherosclerotic or age changes in the external carotid artery. Okay, we got the points. Now we'll go to find out the how can we draw it. Okay, so we have to draw the external carotid artery. Idea is that first point is the level of the thyroid cartilage. The thyroid cartilage is here. This is the thyroid prominence or laryngeal prominence, superior border of thyroid cartilage. So if we at this level, we'll get the first point here. Okay, so we'll get the first point here. Here is the first point. Okay, this is the point here. First point here. Okay, second point will go between the angle of the mandible and the tip of the mastoid process, the midpoint a bit up. So this is the second point. So if we draw a line from here to here, then we'll get the external carotid artery. So we got the external carotid artery. This is a point here. This point is just behind the neck of the mandible or just above the midpoint of a line joining the angle of the mandible to the tip of the mastoid process. This is the neck of the mandible. This is the angle of the mandible, the tip of the mastoid process. So second point is just above the line, the midpoint of a line joining the angle of the mandible to the mastoid process. This is that point. We can say this point, we can draw just behind the lower part of the neck of the mandible. Always remember that the branches and the pattern of branching is variable from person to person. Okay, so we have 8 branches of the external carotid artery. We have the superior thyroid artery, we have the lingual artery, we have the facial artery, we have occipital artery, posterior auricular artery, we have the ascending pharyngeal artery here, ascending pharyngeal artery. Okay, then 2 terminal branches. One is superficial temporal artery, another one is the maxillary artery. Okay, we got that. So these are the Viva questions. What are the points to draw an external carotid artery? First point, at the anterior border of the sternocleidomastoid muscle, at the level of the upper border of the thyroid cartilage. At what vertebral level does the common carotid artery bifurcate? There is also at the level of the upper border of the thyroid cartilage, the intervertebral disc between C3 and C4. What are the branches of the external carotid artery? We discussed that. What are the anterior branches? We discussed. We have 3 branches, anterior branches. What are the contents of carotid sheath? Carotid sheath contains the common carotid artery, internal carotid artery, internal jugular vein, as well as the vagus nerve, not the external carotid artery. Okay. What are the terminal branches of external carotid artery? Superficial temporal artery and the maxillary artery. Okay. What structures are located deep to the external carotid artery? There is the internal carotid artery and the structure between the internal and external carotid artery. Those structures are the glossopharyngeal nerve and the pharyngeal branch of the vagus nerve, the stylopharyngeus, the styloid process, and styloglossus muscle. Okay, so we got then what branches of the external carotid artery are related to the greater cornu of the hyoid bone. This should be greater cornu. Okay, so please make a correction of that. Okay, so we can go there. Okay, so this part greater cornu of the, let me try here. Okay, so that is the greater cornu, we can say greater cornu. Okay, what branches of the external carotid artery are related to the greater cornu of the hyoid bone? Yes, the superior thyroid artery is below the greater cornu, the lingual artery at the level of the greater cornu. Okay, and the posterior, I mean the occipital artery at the level of the greater cornu, and the posterior auricular artery is above the greater cornu. It is related to the posterior belly of the digastric muscle. Okay, and that's all about the surface anatomy of the external carotid artery. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.